Okay, let's be honest for a second. Seeing blood where you really don't expect it, yeah, it's alarming. But when we're talking about anal bleeding, the most important thing isn't to panic, it's to understand. So in this explainer, we're going to give you the clear, straightforward information you need to figure out what's going on and what to do next.
So, have you noticed blood? It's a question that can really make you pause, right? If the answer is yes, your first instinct might be to worry. But hold on, before we go any further, let's get some really important context.
The very first thing you need to know is that you are definitely not alone. This is incredibly common. But, and this is a big but, common doesn't mean we should ignore it. The real key here is to understand what your body might be trying to tell you. All right, so here's our game plan for this breakdown. First up, we'll look at the causes, everything from the most common stuff to the more serious conditions. Then, we're going to pinpoint the exact warning signs that mean you should see a doctor right away. We'll also walk through the whole diagnosis process so it's not a mystery. And finally, we'll cover the simple steps you can take to prevent these issues from happening in the first place.
Okay, let's dive right in with the #1 rule, the golden rule. Don't ignore it. Just understanding what's going on is always the very first step.
So at its core, anal bleeding is just, well, bleeding from the anus. But here's a really fascinating and incredibly useful clue your body gives you: the color of the blood. If it's bright red, that usually means the source is lower down. Think closer to the exit, like in the colon or rectum. But if the blood is darker, almost black, that suggests the bleeding is coming from upper, so higher up in your digestive system. Just that one little detail can be a huge help for your doctor.
So what's actually causing it? Well, the possibilities really do range from the very simple to the more serious, so let's break down what could be going on.
Okay, so the two most common culprits are hemorrhoids and anal fissures. And the key difference often boils down to one simple thing: pain. Hemorrhoids, they're usually painless and often caused by things like straining or even just sitting for too long. Fissures, on the other hand, are these tiny little tears, and they are typically very painful, usually caused by hard stools. While both might cause that bright red blood, if there's severe pain, that's often a sign pointing towards a fissure.
But of course, it's not always just hemorrhoids or fissures. More serious conditions can also be the cause. Things like colitis, which is an inflammation of the colon, or polyps, which are small growths. And yes, in some cases, it can be a sign of colorectal cancer. And this, right here, is exactly why trying to self-diagnose at home is a really bad idea. Getting a professional diagnosis is absolutely crucial.
So while most cases are minor, there are absolutely times when you should not wait. Let's talk about the red flags, the signs that mean you should see a doctor immediately. No waiting around.
Look, if you experience any of these, it is time to make that call to a doctor. Heavy or recurring bleeding, any kind of severe abdominal pain, or losing weight when you're not trying to, those are all serious signs. The same goes for symptoms of anemia, like feeling dizzy and tired all the time, or if you have a family history of colon disease. These are not things you wait and see about. All right, so you've decided to see a doctor. That is a great step. But what actually happens next? Let's walk through the path to diagnosis and treatment so you know exactly what to expect. No surprises. The process itself is usually very straightforward. It all starts with a simple exam at your doctor's office. From there, your doctor might suggest some other tests, like a colonoscopy, just to get a really clear look at what's going on. The goal of all these steps is simple: get a solid diagnosis so a treatment plan can be created that's perfect for you.
And what does treatment actually look like? Well, for most of the common causes, the solutions are non-surgical and pretty simple. We're talking about things like dietary changes, topical creams, or other straightforward measures. Surgery is typically only brought into the picture for more advanced cases that just aren't responding to those initial treatments. The big takeaway here is that the treatment is always tailored to the specific cause.
And now for my favorite part, prevention. Let's look at the simple, effective steps you can take to maintain great digestive health and hopefully avoid these problems altogether.
So what's the single most powerful preventative habit you can adopt? It's almost ridiculously simple: hydration. Seriously, aiming for about 2 to 3 liters of water a day keeps everything in your digestive system moving along smoothly. And that is the absolute best way to prevent constipation, which is one of the biggest triggers for issues like hemorrhoids and fissures.
Beyond just drinking water, a few other simple habits can make a huge difference. Getting enough fiber in your diet from veggies and fruits is key. So is staying active and taking breaks from sitting all day. And this one is crucial. Listen to your body and don't put off going to the bathroom. It's really just a simple cycle of healthy habits. When you boil it all down, it comes back to this one powerful truth from a specialist surgeon. Early diagnosis provides easier treatment and better outcomes. That's really the core message here. The sooner you get answers, the simpler, safer, and better the solution's going to be.
So we're left with one final question, and this one is just for you. Is it time to consult a doctor? Only you can answer that, but I really hope you now have the clarity and the confidence you need to take that next step. Your health is in your hands.